My name is Cigdem. I and Professor Ilker are working at the Department of Industrial Engineering in Istanbul Technical University. And our co-author is a medical doctor who helped a lot in building the model. First, I want to talk about the motivation and purpose of the research. Then I will show you the decision hierarchy. And I will talk about the methodology, but don't worry, I won't explain the theoretical background. I just talk about how we did perform the research, and I will talk about the findings. Actually, there are a lot of reasons to talk about, but I think the main one is the economic one. We have been suffering an economic breakdown for a while, and please don't get confused for seeing two different inflation rates, but both of them are correct according to different groups. Actually, our annual inflation rate is 84% according to the government institution, and it is 170% according to an independent non-government organization. So we have trust issues here. So the second reason is, according to us, of course, the increase in the violence against doctors. In 2012, almost 20,000 healthcare staff asked for help due to experiencing violence, and this number increased to 30,000 in 2022. And similarly, the usage of white coat has increased 8.5 times, from 7,000 to 70,000 in 8 years. So these can be considered as the most important factors affecting this decision.
By the way, what is white coat? What is it?
Hocam, white coat is actually a procedure that the healthcare staff apply when they are suffering from a violence or harassment. Yeah, I thought it is common, but sorry, I should explain.
At least I don't know what does it mean. Yeah.
Okay. And on the right, you are seeing a graph. It represents the field and unfilled positions based on a medical exam in Turkey. Actually, in each year, we have two different specialization exams. And until 2022, each term, around 7,000 practitioners take this exam to be specialists. Let me tell you that 2020 is an exception due to COVID-19. And as you can see, the number of participants in 2022 decreased to 2,000. And 80% of the positions remain unfilled. Actually, when we asked the medical doctors about their opinion, they told us that there might be other reasons of the decreasing number of participants, but the effects of emigration intention cannot be neglected. So we put here this figure as a reason of, as a proof of emigration. And finally, this figure represents the number of doctors who applied to receive certificates of good standing. This is a certificate which is required to be able to work abroad. And from 2012 to 2022, you will see that the number of applications increased from 60 to 2,417 according to the Turkish Medical Association. So we decided to offer a decision model, a comprehensive model to examine the factors affecting the emigration decision of medical doctors. And hopefully the findings may support the policymakers to deal with this problem. Here you may see the decision hierarchy. We have 7 main factors: psychological factors, financial factors, personal development factors, political system design, working relationship, and working conditions factors. But I want to show you this table. It will be more clear. As you can see, most of these factors are from the literature, but after preparing the model, we consulted the medical doctors to examine our model, and they offered us to include some counter-specific factors. I want to talk about them. For example, concern about ethical violations caused by the newly established medical schools in mostly in foundations university. In Turkey, we have two types of universities, one public, one foundation universities. And the doctors told us that they have concerns about the quality of the education in these faculties. And also they have suspicions about the judgments of these graduates about the alternative ways of treatment. So they insisted us to include this factor to the model. And the other counter-specific one is the conscription liability, which is some kind of compulsory service that doctors have to perform. So in addition to that, they asked us to include the, let me check, future anxiety, in addition to the frustration with the political situation, and also the unfair performance payments, in addition to the insufficient performance payments. So if you have any questions regarding the factors, you can ask now, or I can wait until the end of the presentation. Okay.
Maybe we can ask at the end so that you can use as much time you want to.
Okay.
If you leave us some time for questions and answers, we will ask.
Okay. I hope I will. And how did we perform the analysis? Actually, we prepared an online questionnaire, including 45 pairwise comparison questions and 7 demographic questions. And also we have 4 questions specific to the people who are already abroad. And 73 people participated in our questionnaire, and we aggregated their assessments using geometric mean. And we used super decision software to analyze the assessments. And also we examined the preferences of different groups. Now I will show you first the overall results, and then I compare them with different groups. First I have demographic information. As you can see, we have several participants from different age groups and several participants with different specialties. And also we have people who want to emigrate, people who don't want to emigrate, people who have already emigrated. So we have people with different emigration intentions. We try to reflect the preferences of these different groups. And for overall analysis, the political factors is the most important main factor, following by the financial factors. And the least important one is the working relationships. When we examine the sub-factors, low remuneration is the most important sub-factor, following by the future anxiety due to the political situation, loss of professional reputation. Here, doctors think that the actually respect to their profession is decreasing day by day, and personal security concerns are among the most important ones. While distressing relationship with peers, lack of research funds, lack of opportunities to gain experience are among the least important ones. I won't read all of them. It is on the paper actually, and if you want, I can share the presentation after I finish. So I continue. I couldn't. Okay. here we have preferences of doctors with different specialties. And when we examine the results, we realize that trainees have concerns with future anxiety due to the political situation and personal security concerns. And for practitioners, the most important factor is the low remuneration, actually the financial factors. And when we check the gender differences, as expected, women prioritize the personal security concerns, and compared to the overall results and compared to the results of men, mobbing has a higher position among others for women. And when we check the preferences of groups with different intentions, actually people who are currently abroad didn't prioritize the, let me check, the loss of reputation, loss of professional reputation as important as people who are in the country. For them, for people who are currently abroad, financial factors seems more important. And for people who don't want to go, the financial factors and future anxiety due to the political situation seems important. And when we check the preferences of different groups, I just want to focus on the differences, so I don't want to interpret all of them. But for younger people, different from other groups, the lack of research funds seem important. And again, for younger groups, long working hours is important. And I want to give you an additional information here. In addition to long working hours, actually, medical doctors are suffering from workload, because in Turkey, they have to examine a patient in 5 minutes. When we try to take an appointment for treatment, we are allowed to take appointments for 5-minute periods. So in addition to long working hours, actually high workload also affects their decision. And not elderly, but experienced people thinks that future anxiety due to the political situation is more important than other factors. Actually, for them, political factors is the most important one, while for younger people, working conditions is the most important main factor. So, people from different disciplines have been emigrating, but in this study, we focused on the medical doctors' emigration and prepare a decision model to examine the factors affecting their emigration decision. And we hope that these findings may support the Ministry of Health in Turkey and the Turkish government to take precautions to prevent this brain drain. And also we have suggestions to improve our work. The model can be applied to the entire healthcare staff, but first we should modify it. And also the number of participants who have already emigrated should be increased to actually have an insight about their preferences.
Okay.
I don't know if I can use my time, but
yes, you are on time. Thank you, Cigdem, for this valuable presentation. Well, as Turks, all of us suffer from decreasing number of medical doctors. So I hope that policymakers focus on this problem as soon as possible in a scientific and, of course, in an objective way, as they have already done in your research. Well, are there any questions or comments?
I had just a quick question. Please. Just the remuneration, the payment part was obviously very important to everybody. How does it work in a hyperinflation economy? I mean, does every paycheck, I'm just wondering, actually, does every paycheck get increased? Or, I mean, every month your paychecks keep going up? Or
No. If they are a part of a public industry, they are public doctors of public hospital, their salary increase in every 6 months.
Oh.
But I'm not sure about the doctors in the private industry, so I can't say anything about it. But if anyone knows, Professor Şule or Ilker, they might say something. No.
I see. You can see it just, I guess then month over month, you're actually getting paid less and less as the inflation is going up until it gets adjusted, which is really tough.
Yeah.
Thank you. It was a really good presentation.
Yeah. What is
Thank you for your comments.
Salaries increase, then prices increase immediately. So it doesn't mean anything. And it's really terrible. And I don't know if any other country has this kind of problem all over the world. And Turkey never had it. All these doctors emigrating. So healthcare is in big trouble. In big trouble.
There's a crisis in the healthcare sector.
Yeah. And I would say one thing maybe. Do you need it all these criteria? I was just thinking, there are quite a few criteria. Do you really, how can we, of course, this is a question for all of us. Do you need all these criteria? You had quite a few criteria.
Yeah, there are a lot of criteria, but actually, this is our final list of criteria. We have more, and we eliminated it to have this model.
Thank you.
Also, I forgot to tell you, but according to the reviewers' comments, we performed the sensitivity analysis, but since we don't have any alternatives, we assume that the main factors have equal weights, and then we performed the sensitivity analysis. So I didn't put here, but we will probably use it in our paper.
Okay, thank you.